friends. I'm Jeanice Mitchell. I'm a pelvic health physical therapist, and I'm here with My Pelvic Floor muscles and also My Pelvic Bra. And I'm going to be joined by a board certified urogynecologist by the name of Dr. Karyn Eilber. She is with Femetry. And so give us just a minute to get set up here.
Oh, yes, success. I know, that was so bizarre. I mean, you should literally just press the button.
I know. I agree completely. And it was weird. Like I was getting weird messages popping up from Instagram too. So just so you know, I have had probably the last 3 Instagram lives that I've done. There's been some glitch one way or another. So maybe something
You know
on
why it
Instagram
is?
side.
I think you're so popular, you are overwhelming the system, and so all of this information cannot fly. That is the only plausible explanation.
My face is turning red. No.
You're so cute.
No, thank you. I'm sure it's not that though, but I'm so glad that we got connected. And please, okay, so everybody that's here, we're going to do some live giveaways. So we want you to ask questions and
Yes,
comments, and you never know who we're going to choose. Nothing is TMI here, so just give it to us. Dr. Eilber, could you please tell us a little bit about yourself and then also introduce Femetry?
Yes. So thank you, everybody who is logged in. I'm Karyn Eilber. I am a urologist by training with a specialty in urogynecology. And that means I treat a lot of incontinence, prolapse, which is what exactly my pelvic bra can help with. And we also take care of diseases like interstitial cystitis, which are chronic bladder pain conditions, or people who have urinary frequency and urgency and bladder discomfort that maybe hasn't been diagnosed. And because my colleagues and I saw so many of these patients, mainly women, who are treating themselves and successfully a lot of the times with supplements, we figured, why don't we use our clinical knowledge, the available science, and put all these supplements together into, or ingredients into one supplement. So that's how Femetry came to be.
Okay, great. So tell us, okay, so I have so many questions. And oh, by the way, you guys, we are friends. Like we were neighbors at a recent event. Like we were next door neighbors. Literally, our tables were probably 8 inches apart.
And I put on and I thought looked pretty good in a pelvic bra, I have to say.
I love it. And Dr. Eilber was such a sweet neighbor. And then I left the conference early. And so we just had a few like flyers out there. And then we had a lady come. Would you tell the story? You tell it so much better.
Yeah, she was from the meeting international. I don't remember what
Maybe
country.
Europe? Somewhere?
Yeah, I think so. And she was so disappointed because she wanted, to see your product. And I happily took mine off and gave it to her. And I said, you can have this as your sample one. And then, of course, Jeanice was kind enough to send a separate one. But listen, women's health is just one of those things where we need to work together, whether it's because we're neighbors at a meeting, doing Instagram Live, to just get the information out there so that we can help all the people possible, because prolapse, incontinence, chronic pain, they're diseases where not only are people a little bit ashamed to have them, but don't even necessarily know where to go for help.
Right, exactly. Okay, so give us, I love that. I love that. People deserve choices, and people have been suffering in silence. They've had shame and embarrassment and fear, and they have felt despondent, like they're alone, right? I was watching one of your videos today, and I love that. Like, just to have someone come in to our offices and to say, you're not alone. Like,
well, I think just to come into an office and that someone actually knows what you're talking about. I did a podcast the other day and with 2 very educated women. It's funny, it's filthy MILFs, which I think was really funny. And they didn't even really know what a urogynecologist did. And most people don't know that there are specialized pelvic floor physical therapists. Thankfully, your whole group is very active on social media these days. So people probably know more pelvic floor physical therapists do. But I think that women in general, you put us on task and we will do it. So I think that if we're here to help women, we can answer questions and do whatever it is that we can do to, no pun intended, support your pelvic floor.
I love it. I love it. Okay, so tell me more about Femetry. How might someone, what actually is it? So you formulated different things. So is it a pill that you take orally? Is it something that you put inside your vagina? Like, what do we do with Femetry?
Great questions. So one of the things that happens a lot of the times is people, when women have any kind of bladder symptoms, right off the bat, we assume it's a bladder infection. So a lot of people who have interstitial cystitis or other chronic bladder conditions get lots and lots of antibiotics. So the first step in Femetry is kind of a reset to get your bladder kind of microbiome back to normal. So we have like a pro and prebiotic formula, which is more of a powder. And you take that usually for 2 weeks. Some people like to maintain it longer term. And then there is a daily supplement that is daily comfort, because one of the reasons why people can get bladder discomfort is the lining of the bladder should really be impermeable, right? I mean, urine is basically a waste material. But if your bladder lining isn't normal and you don't have that top layer, if you will, to protect the bottom of the bladder from all of these acids and other things in the bladder, then you start having all these bladder symptoms. So we have within the supplement hyaluronic acid, things that help to build up what's called the glycosaminoglycan layer. And this is something that is meant to take every day. And then there are other people who really say, you know what, I eat certain foods, or I didn't know there were certain ingredients in what I ate or drank, and I'm having a flare. And this is a lot of times because of acidic things. So then there is also something that's kind of a rescue, if you will, that people take either in preparation for a meal or a drink they want to have, or sometimes they inadvertently took something. So those are things you just kind of take as needed. So there's really 3 different steps in the whole kind of Femetry process.
Okay, that is awesome. I have questions, but while you guys are here, we are doing giveaways today for you guys that are live. All you need to do is write something. Give us a question. Give us an interesting, I mean, it can be any question, but especially if it's very interesting, you never know if you might get selected. So as we continue talking, please give us your questions. And
it doesn't have to be a bladder specific related question. It could be anything with the pelvic floor, anything that you guys want to know.
Exactly. So do people need to do anything? Is there any kind of testing that's required before you start? Or how do you know if it's safe and good for you to start?
Well, these ingredients are pretty benign. I mean, it's all safe to start, but you do want to make sure you don't have any other condition going on. So if you really think you have a bladder infection, of course, go to your doctor, make sure that gets checked out. But a lot of the people who get these conditions, they do have negative tests for urine infections, and they keep going back and forth. So we did a little study, and about 40% of people who have chronic bladder conditions are managing themselves with supplements. So you can start anytime. I especially encourage people who, if you have been taking antibiotics over and over again for UTIs, and even if your tests are negative, and especially if you don't get better with antibiotics, then maybe you don't have UTIs. So one of the things we like to say for Femetry is it's for when it's not a UTI. So
I love that. I love that.
Yeah, because just because you have frequency and urgency and discomfort does not mean you have a bladder infection.
Mm-hmm. I mean, I'm sure you see so many people, but the volume of people that feel like, we saw your question, by the way, we're going to get it. We're going to grab it. The volume of people that think that they have a bladder infection or a urinary tract infection because it's burning when they urinate. They feel bad. It's painful. And then they go in and it's actually not an infection. This would be a perfect product.
And what's very interesting also is, there's much more coverage right now in the media, and so traditional media and social media, about genitourinary syndrome of menopause. So one of those things, because of the lack of estrogen, you get an imbalance of the good and the bad bacteria. So in fact, some of the bacteria that are part of the probiotics within Femetry, the number 1, are specifically have been found to help perimenopause and menopausal women, because all of our microbiomes are not the same. Like, I hate to tell you, but like your vagina is not the same as mine. And so not all one probiotic is the same. And in fact,
I don't think you want my vagina though.
I don't know. You have a pretty good pelvic bra, TMI, but and there are different, even though lactobacilli are the good bacteria, there are different types of lactobacilli. So certain ones are actually more beneficial for women who are menopausal or not. And there is this synergy. So interestingly, right, there are, like if you take Tylenol by itself, but you mix with Advil, you get much better pain control. So when you have certain probiotics, you mix them with other ones, you mix with other ingredients, you get better results. So a lot of the ingredients that are within the Femetry products are because they have synergistic effects.
That's really cool. Okay. So okay, before my next question, let's answer the question from our
Yes.
audience. So can
And
you
we need our
explain,
winner.
no, exactly. Can you explain why is there ashwagandha in bladder control?
Because a lot of people who get chronic bladder conditions or any chronic condition, they get a lot of anxiety, they can't sleep well. So ashwagandha is just something to help with the stress and anxiety, because stress also makes every condition worse. Okay. So ashwagandha is not necessarily specific for interstitial cystitis, but it is very helpful because a lot of people will also say, you know what, I had a really bad day at work. I had a flare of my bladder. So it's just to help overall with that stress and helping to decrease cortisol, which makes everything worse.
Okay. Is there ashwagandha in Femetry?
Yes.
Okay. I want to try Femetry. Like, this is really exciting.
Yeah, it's not specific for IC. It's really, I mean, even people who have just recurrent UTIs or these types of symptoms with other conditions, or, you know, it's kind of like having, I don't know, irritable bowel or a lot of other conditions where they're not so easy to diagnose. You don't quite fit into that diagnosis, or maybe it's not so bad. You don't want to go to the doctor and you just kind of figure out how you can help yourself. Absolutely.
I love that. Okay. So for you guys, we just have a winner. So we're doing
Yay.
live giveaways here. As long as you live in the US or you, like, it's US shipping. Okay. And I guess if you were outside of the US, maybe if at least
if you had a friend who can send it to you from their US address, that would work too.
Yeah. So we have a winner. So make sure you direct message us. And that's exciting. So LavaRes7, give us a direct message, and we will send you a little packet from from Pelvic Bra and from Femetry. Okay, so hello from Ireland. Hello.
Wow, Ireland.
I'm really, really happy that you're here. Here's another question. So I have some patients who come to me telling me about Femetry, and they say it seems to work for them. Are there any contraindications or people who shouldn't try it? I love that question.
I mean, you know, full disclosure, it's not fully tested like an FDA approved drug or anything like that. But I think honestly, outside of like allergies to any of the ingredients that are in there, I mean, they're supplements. So as long as they are used within the recommended dosing, there really shouldn't be any contraindications. I mean, again, people who have severe liver disease, severe kidney disease, where everything they take, of course, has to be with caution. But outside of that, should not really be an issue.
Mm-hmm. Okay. Can you give us some success stories of people that you're hearing that are using Femetry and what you're hearing from them?
I mean, I think some of the biggest success stories are just they're not having as much pain anymore. So Femetry, I think, is truly a great product. Otherwise, I wouldn't have been involved with it. And my two colleagues who helped to develop it, you know, are also, we really believe in it. Having said that, there is no perfect drug. There's something that takes care of everything. But for a lot of people, and interstitial cystitis, you can't just take Femetry and then eat whatever you want to, right? Or live a totally stressful life. Every disease state, you have to optimize your health, optimize your diet. This is part of, you know, just the overall picture. But, you know, it's people like, hey, you know what? I can actually drink coffee again and not, you know, have a horrible day. Or I'm actually okay going out to eat with my friends and it's not such a stressful situation. So for me, the success stories are people just really being able to live their life without having such stress over it. And I'm sure it's the same for you with your patients too.
Yeah, absolutely. Absolutely. Like it is a joy to us when we hear people being able to exercise or go travel or do whatever they wanted to do without symptoms. Like that is our common goal. We want to help you live your best life without fear of leaking and pain and bulging and all the things that are possible down there.
And I think feeling good, you just feel a little more control of your life, right? Like knowing you could put something on and not have to worry about something feeling heavy or bulge down there, being able to go out to eat and not having, you know, this whole anxiety when the food gets delivered to your table. So it's really about quality of life, you know, and people living the life they want to.
Mm-hmm. Right. And I feel so bad as a physical therapist. So sometimes when I'm educating people about bladder health and about dietary irritants, the list is long and it's terrible. Like you're taking away all the fun things that they want to eat
So
potentially. And
what
so
can I eat? You can
I
basically
give,
have bread and water. Yeah, that's
I know, and a banana maybe.
yeah, yeah.
I give like this disclaimer, like, hey, this does not mean you have to stay away from all of this, but we need to figure out what is your irritant, what's bothering you. And so this could even potentially help people ingest some things, at least maybe partially or occasionally, that they really enjoy, that they may have had to take out of their diet because it's been irritating their bladder. So that would be.
I think whether it's Femetry or pelvic bra, this is something that gives people some kind of, again, back to control or power over their situation, something they can do for themselves. They don't have to wait for an appointment to see a doctor. These are things that they can do on their own.
Yep. I like one other kind of analogy here. I like to think about kind of a carpenter with a tool belt, okay? And you have different tools for different things. And so we're presenting today 2 tools. So the pelvic bra is wearable support wear. You don't have to like thongs to wear it. For people that need some extra support and lift, and that can happen at different times in life. And then we have another tool, which is Femetry, to help with the microbiome and to help with the lining and help bladder health.
You got it. Right. So if you're, again, bladder symptoms, urinary frequency, urgency, overall discomfort, just dealing, recovering from recurrent urinary tract infections, it's really just for overall bladder health.
Yeah, I love that. Okay, well, I know what some people are going to be getting for Christmas too. So they expect this from me, though. I'm telling you, if I didn't give them something pelvic health related, they would be disappointed.
Yeah.
Okay, we have another question, and then we'll probably be wrapping up here in a couple minutes. So my so you have a bladder prolapse, and I'm told is causing your bladder infections, and a hysterectomy will fix the problem. So so the comment here is drastic. I'll give you my thoughts, and then as as my urologist surgeon here, please jump in. Sometimes what can happen is that I actually have.
Of course you do.
Surprise, surprise. I have a graph. I have a chart. Okay. So here's the pubic bone in the front and the tailbone in the back. And here's the bladder and the urethral canal where the urine exits. And then that's the vaginal canal. What can happen sometimes is that urine can kind of pocket back there and it doesn't empty. And so it's kind of sitting in that pocket. And so that's one possibility of why you may be getting urinary tract infections. And there's things that we can do even conservatively to help that bladder empty by vaginal splinting. So there's something called vaginal splinting, and there's tools for that. So I'm not saying, no, you don't need surgery. This isn't medical advice. This is to increase awareness. But I'd love to hear what you have to say, Dr. Eilber.
Yeah, I think we both have that disclaimer. This is not full medical advice, but prolapse is common. Recurrent bladder infections are common. They're not necessarily like directly related. So and also you may have very mild prolapse, which is unlikely to cause incomplete emptying of the bladder. So if I see a patient who has maybe mild prolapse and they're not really bothered by a bulge, we try to prevent the infections, at which sometimes if they're perimenopausal or menopausal, you might need some vaginal estrogen. Sometimes you can do something as simple as taking like a cranberry supplement. But it really depends on finding out, if that prolapse is indeed causing incomplete bladder emptying, which could contribute, but it also may be unrelated. And if it's really just the bladder falling and the uterus is not falling much, I don't know that a hysterectomy is necessary. But again, this is not to be taken as medical advice, and without actually knowing the degree of prolapse on exam, and if someone is emptying their bladder, it's really hard to know. But for my patients, if the recurrent UTIs are what's really bothering them and they're able to empty their bladder, I don't know that we need to fix the prolapse. We just need to do something to prevent the UTIs.
Mm-hmm. Yep. We just had a webinar earlier this week on some of the recent research that was presented at AUGS. So that's the American I don't know.
Yeah,
I think it was
American Urogynecologists Society, yes.
Mm-hmm. And so one of the studies that I was excited to hear, because prolapse is like the second leading cause of hysterectomies. So one of the articles that they were presenting was basically uterine sparing.
Uterine preservation, right.
Yeah.
Yeah, I think we do a lot of how should I say, elective hysterectomies in this country. And I always wanted to do a study if we interviewed, say, like, I don't know, 100 women who were age 70 and over and asked why they had a hysterectomy. My guess is most of them don't know why.
Right. Yeah. Yeah, that would be fascinating. That would be
Yeah,
fascinating.
you don't, I mean, if a uterus isn't like severely prolapsed, you could absolutely just lift it up. You don't have to take it out. And it's a much smaller operation.
Right. Yeah. So that's food for thought. And, you know, there's
food for thought, not total medical advice.
Mm-hmm.
Disclaimers from both of us.
Yeah, exactly. But I love that question too. So you're a winner of a giveaway if your address is in the US. So we have 2 giveaway winners. Please direct message myself, My Pelvic Floor Muscles. And do you want to also message Femetry, or
we can do that too? But between the 2 of us, we will make sure that you get your giveaway.
Send us both messages, and between the 2 of us, we'll make sure you get your goodies. And if you're watching the recorded version, we are going to do another giveaway but before Saturday. So leave comments. And do you want to add anything about the giveaway, Dr. Eilber?
Do I want to ask anything about it,
or add anything? Like, I'm creating some rules as we're going along.
Yeah. Whatever rules Jeanice says, I'm with it.
Okay. Awesome. So we want you guys to try out these tools and just imagine, remember, like throughout your lifespan, there's going to be different things that happen. We want to help you live an active life. We want to introduce you to different tools that may help you live that active life and help you understand when this tool might be helpful for you. So I hope that we achieve that goal today. I know this was a labor of love, Dr. Eilber, and I can't imagine how much time and energy and resources went into this. So I'm really excited to see this grow and be able to help more people live their lives. And I thank you for your time, and I look forward to doing this again.
Thanks.
All right, everybody. Take care. Have a good weekend. Bye-bye.
Bye-bye.